Hi, thank you for joining us. So today we're going to talk about a topic that nobody wants to talk about, and that is pain with sex. So my name is Heather Dunfee, and I am a pelvic floor physical therapist at ActivePT and Sports in Rochester, Minnesota. And I am a mom of three little kids, ages 5, 3, and 5 months.
And I am Mary Kleis. I also am a pelvic floor physical therapist at ActivePT in Rochester. I'm a mom of 2 daughters who are 21 and 20. And like Heather said, we're both pelvic floor physical therapists who are trained in evaluation and treatment of the pelvic floor, which is really important for bowel and bladder function, support and stability, as well as sexual appreciation, which is what we're going to talk about today.
So Mary, I have patients, they come in and this is a really sensitive topic, and they say to me, I'm having pain with intercourse. Is this normal? Is it just me? What do you say to them?
I say that while it is common, it is not normal. About 3 out of every 4 women experiences pain at some time in their life with intercourse. It's common during postpartum period. It's common when you first are beginning your experience with sex, and also during the postmenopausal period. And it can really be a barrier for people with their intimate relationships. So a lot of people will say, why does this hurt? And what can I do? And how do you answer that, Heather?
Yeah, so there are a lot of reasons why it can hurt. And the first thing that we want to take care of is any type of psychological or emotional reason why sex is hurting. So maybe you've had a poor experience with sex in the past. Maybe you've had a history of abuse or other reasons, or just a poor emotional connection with your partner. So that's something that we want you to talk to an appropriate mental health provider or a counselor before going any further in this journey. But there are a lot of physical reasons to why sex hurts, and that's what we're going to cover today. And so the first thing is hormones. And so hormones play a huge role in all things sex. Am I right? So they
Absolutely.
really, right? They contribute to our lubrication, libido. They even contribute to our muscle elasticity and strength. And there are a lot of stages in our life where our hormones are shifting, and that can really implicate the comfort and how we experience sex. So for example, when you're postpartum and you're breastfeeding, or when you're in this postmenopausal state, there's a lot of, you have decreased lubrication, and there's a lot of vaginal dryness, and that can lead to a lot of tissue irritation and even tissue breakdown. So it's really important to just know that there's different stages of life where our hormones play a role. And even if we're not getting enough sleep, or even if we're stressed. So I bet I just described probably everyone out there that's listening, right?
It's true, especially in these times. Um,
Right.
so you had mentioned lubrication, and there are a lot of different types of lubrication, different brands and different ingredients that are involved in this, as well as our natural lubrication. So what do you say when someone says, well, what should I be using?
Yeah. So don't be afraid to just use a lubrication that you buy in the store or online. This is really going to help decrease that friction and prevent that skin irritation that I was talking about. But it's important to look for something that is non-toxic, kind of all natural ingredients, typically a water-based solution for lubrication. We're going to also want to be careful of just any general over-the-counter lubrication, especially if it has anything that heats or tingles, because that can really irritate the skin.
Yes. And then also sometimes women who are postmenopausal will have dryness just because of changes in their hormonal state. So this might be a conversation that you should have with your doctor about whether having a lubricant, an estrogen cream or suppository would be appropriate for you. And we do recommend to have open conversations with your doctor about those issues.
Yeah, good point, Mary. Another thing that I wanted to mention here is that it's really important to take time for foreplay during these stages too, because that helps increase our body's natural ability to produce lubrication. And it also provides blood flow to the pelvic floor muscles. And so that increases their ability to relax, their ability to be mobile or just stretch. And it actually just gets you in the mood. So it's definitely an important piece to this.
Something that we need to remember is that sometimes the pain from sex is coming from scar tissue, and there can be vaginal or abdominal scars that can contribute to pelvic pain. And it's important for these scars to have normal sensation. What do you recommend for people when they have a scar, either due to childbirth or some other cause?
Yeah, scars can definitely play a huge role in pain with intercourse. So the first thing that we want to do is desensitize the scar if it's painful, or if it's numb, bring some normal sensation to the tissue. So what I like to say is just work on some gentle desensitization. So can you just gently touch the scar? How does that feel? Can you tolerate that? And then over time, we're going to build on that pressure. So we're going to apply a little bit more pressure, stroking the scar. Maybe I'm going to pull the skin away from the scar that's around the scar. I'm going to pull and stretch it a little bit. Can I tolerate that? And then eventually I'm going to just increase the pressure. I'm going to do a little bit of cross friction massage, might even do some twisting. But really the goal of the scar is to get it feeling like normal tissue and to get it moving like normal tissue. So we don't want the scar to be numb. We don't want the scar to be painful, and we don't want the scar to be bound down. And so external scar tissue mobilization on a C-section scar, or even on a perineal scar from an episiotomy or a vaginal tear, is really easy to do yourself, maybe in the bathtub, maybe in the shower, maybe just laying on your bed with a little bit of lubrication. But the scar, vaginal scars can also be internal into the vaginal vault. And so that's when you might need a little bit of help from a pelvic floor physical therapist to work on mobilizing that scar for you.
Yes, and I'm glad that you mentioned the abdominal scars from a C-section, because those go through several layers of abdominal muscles, and they do contribute to pelvic pain and discomfort. And I will often recommend to people to use different textures and even different temperatures when they're trying to desensitize their scar tissue. And then as well, remember that not only with C-sections and childbirth, but some people will have a vaginal procedure done, either a hysterectomy or a bladder sling procedure. And those result in scars as well, which can have some scars internally and externally that we need to help people to keep mobile and help get that normal sensation back in those scars.
Good, excellent points. There's another big player here on why we have pain with sex, and that's the pelvic floor muscles. The pelvic floor has a lot of jobs, and so these muscles can get really tight. They can get trigger points, they can get tender points, just like any other area in your body. And so it's really important that we address those things. So Mary, what are some of the main things that we do to help address those muscles?
Well, I think that the biggest thing that we need to do is help those muscles learn to relax. And I think that's the first place that I go anyway, is helping a person be aware of their pelvic floor muscles, and just begin with diaphragmatic breathing and some relaxation exercises that can really help restore the range of motion to the pelvic floor muscles and reduce the tension overall. I try to have people do frequent self-checks, because in the same way that we hold tension in our shoulders, we hold our tension in the pelvic floor as well. And so just frequently assessing, where am I holding my tension and can I let that go? And then recognizing that we're not going to pee ourselves if we let that tension go is also really important.
Right. I know that you make such a good point. I notice I hold tension in my shoulders, and if I reach up here, I even feel like a really tender spot. And people do that in their pelvic floor all the time. They're just holding. So we just need to work on letting that go, right?
Exactly.
So you talk about breathing. So I just wanted to touch on that really quickly, just so everybody knows how to breathe correctly. So when we think about breathing, we think about our system of breathing. And so if we think about our core, we have our diaphragm on the top, which is our breathing muscle, and our pelvic floor on the bottom, which is the base of our core. And so when we inhale, our diaphragm descends and our pelvic floor descends and actually lengthens with that inhale. And then when we exhale, everything recoils. So in order to breathe, to relax the pelvic floor, we really need to focus on that good diaphragmatic breathing, belly expansion, and even feeling that lengthening occur in the pelvic floor. And that's something that can take a lot of practice, and a lot of people are doing it backwards, right?
It's true. I frequently have to help people learn how to breathe. And I often will have someone place a hand on their chest and a hand on their belly and really allow the belly to rise with your inhale, and thinking about allowing the pelvic floor to drop with that inhale, and trying to avoid a lot of this chest breathing, which kind of comes with that flight or fight response. Like it's really a stressful type of breath. And the diaphragmatic breath is so important for the pelvic floor, like you said, for the range of motion.
And you mentioned the flight or fight response. So what do we do when we think something is going to be painful? We think it's going to hurt, it's going to hurt, it's going to hurt, it's going to hurt, right? And we start clenching and we start tightening up our muscles. So even when we're, thinking about sexual activity, we need to work on thinking about it and just trying to relax and work in that nice deep breathing as well. There are also positions that we really like to put people in to help really focus on gentle stretching of the pelvic floor and to really focus on this relaxed breathing. So Mary, if you want to pull up those yoga stretches to focus on some nice diaphragmatic breathing and to focus on stretching the pelvic floor and the muscles around the pelvic floor. So we're often really tight in our leg muscles and our glute muscles and our abdomen muscles, as well as our pelvic floor muscles. So the first picture there is just called a happy baby stretch. And really the focus is on, drawing our air in and trying to feel our pelvic floor lengthen in this position. And then the second pose is just a simple butterfly stretch. And that's really focusing on lengthening our adductors, our inner thigh muscles, which attach to the pelvic floor. And then if you want to skip to the next slide.
Yep.
A few others that you can do that help work on lengthening the pelvic floor. Child's pose I really like. This is a really nice stretch to work on the posterior pelvic floor and to work on maybe if you have tailbone pain, this can help with that too. Really the focus is on drawing your air into your pelvic floor, thinking about lengthening through the tailbone and lengthening into the low back. And oftentimes I'll put my hand on somebody's tailbone area and I can feel them when they inhale, I can feel them expand and breathe into my hand, and I can feel that lengthening. And then the other one is just a simple deep squat position to work on lengthening and breathing.
And I think it's important to note that these are exercises that we have helped people learn, because we want to make sure that you consult with the medical professional or come in for a screening appointment with us so that we can make sure that these are appropriate for you. Sometimes I find that pelvic pain that's due to this pelvic floor muscle tension is because they don't have enough stability in what I call the lumbopelvic stabilizers. So the glutes are an important part. The core is an important part of that. And if we don't have that hip stability, then our pelvic floor ends up just holding on for dear life to help us stay
grasping for support.
Right. Help me stay upright. And so I really try to help people with some beginner core and glute stabilizing exercises.
Okay, good. So we talked about, the big thing is, pelvic floor relaxation, using lubrication, positional stretches, awareness, scar tissue mobilization. Is there anything else that you think our viewers would?
Well, sometimes people ask me, so in the same way that a runner might say, do I have to stop running? Someone might say, do I have to stop having sex? And so I often answer, that really is up to you. It's a conversation that you should have in an open, honest way with your partner, and make sure you have the conversation about how you can be intimate without experiencing pain. Because I do have patients sometimes who say, I get a kiss on the cheek and my pelvic floor gets tense because I just
Right.
know that it's going to hurt. So I will invite people to create a sex menu with their partner, where on one side are the yes things, like these things are okay, they do not hurt me, they cause pleasure to me, they cause pleasure to you, and these are ways that I can feel intimate and connected to you.
Right.
And then on the no side are those things that really hurt, and that would include intercourse. Sometimes it might be a different kind of no thing, and that is completely between you and your partner. But I think it's important to be able to have that open, honest discussion and create that trusting relationship. But we
Yeah.
do try to break that cycle of intimacy and pain. And
Right.
it might be something that you take it out for a couple of weeks until you decide, hey, I'm ready to give this a shot again.
Right.
Now, sometimes we do have other things that we can do in addition to exercise and stretching. What are some of those things that we do as pelvic floor PTs to help out?
Yeah, I'm glad you asked. So, there are things that we do to help stretch out the pelvic floor muscles, pelvic floor relaxation, soft tissue mobilization, trigger point release, and stretching in order to work on relaxing those muscles of the pelvic floor. And I find that my patients are really, the pelvic floor really responds well to that kind of therapy, and being able to help give it a little bit of help to relax, and then doing some of these maintenance breathing, stretching exercises, awareness exercises, then we can have a lot of success to decrease their pain, their pelvic pain in the future. I think we covered a lot of it.
I
I
think
want
we
to make
did.
sure that people feel comfortable reaching out to us for a free screen to see if pelvic floor physical therapy is appropriate for them if they have more questions. So feel free to reach out to us, even if you have questions, if you'd like a free screen to feel to determine if pelvic floor PT is right for you. We're happy to do that, and we can make an appointment over telehealth appointment or an in-person appointment as well.
Yes, so please feel free to contact us. Thank you so much for your time.